Hello, dear doctors and dear Aniridia community. I'm happy to welcome everybody to this fifth Aniridia Europe conference. I hope everyone is doing well and is healthy. I'm glad to speak today about the impact of the diagnosis of congenital Aniridia and Vagus syndrome on the palette of the psychological states of patients with Aniridia and Vagus syndrome and members of their families. During the past 30 years, aniridia and Vagus syndrome has been actively studied and researched by geneticists and ophthalmologists. Scientists began to describe the neurological and endocrinological manifestation of these diseases. So now we pay enough attention for the physical health of patients with aniridia and Vagus syndrome, but practically we almost forgot about their mental health. And it's a very important fact that the diagnosis of congenital aniridia and Vagus syndrome has a huge impact on the psychological health, not only for patients themselves, but also their family members. The importance of studying the effect of the diagnosis congenital aniridia and Vagus syndrome on mental health of patients with aniridia and Vagus syndrome was noted for the first time in the book written by Jill Nerby and Jessica Otis, Aniridia and Vagus syndrome, a guideline for patients and families. In this book, in addition to medical issues, for the first time was mentioned the importance of the psychological support for families with aniridia. Also, we know that living with a chronic or a progressive condition can cause big changes in the mental health of a patient, and this in turn can affect their physical health more. Research on this topic was conducted by the King's Fund Charity and Centre for Mental Health in the UK. The article was published in 2012, and it's noticed that 30% of people with long-term physical health condition have mental health problems. In May 2018, Genetic Alliance UK published the results of a very important research, Living with a Rare Condition, the Effect on Mental Health. The results showed us that living with a chronic condition can have negative impact on a patient's mental health. Also, patients and carriers affected by rare diseases are rarely asked about their mental health by healthcare professionals. Around half of them never asked. So we see that the interplay between mental health of patients with congenital aniridia and Vagus syndrome and members of their families has not been explored properly until now. 6 years ago, we assumed that aniridia and Vagus syndrome, like all other rare diseases, have a very huge influence on people living with these conditions, and our assumption has been confirmed by our study. We also found that congenital aniridia and Vagus syndrome affect not only mental health of patients with aniridia and Vagus syndrome, but also the mental health of their family members. 6 years ago, we started our work in this area. At the first stage of the research, we used Professor Prokhorov questionnaire, relief of the mental state of the individual, a complex method that made possible to analyze all types of mental conditions of patients with aniridia and members of their families. Then we use Eysenck questionnaire of mental states. The questionnaire made possible to analyze the level of anxiety, frustration, aggression, and rigidity. 4 years ago, we developed our special online questionnaire in 2 languages, English and Russian, consisting of 33 questions for the study of some psychological states that were dominant in previous questionnaires. Basically about the presence of these psychological states. The respondents had the option to answer yes or not about the presence of the psychological state. If yes, then often or sometimes. Then we asked to describe and specify in which circumstances do the psychological state usually appear. Let's see what is the comprehension of the psychological state. Psychological state is an integral characteristic of mental activity of an individual for a certain period of time, showing the uniqueness of mental processes flow depending on the reflected objects and reality, the previous psychological state, life experience, and personality traits. All psychological states can be divided in some groups by durability, momentary, episodic, and prolonged, and by effect on the individual's health. Psychological states that have positive effects on the individual's health, and psychological states that have negative effect on the individual's health. Psychological states that are repeating often or prolonged after a while can be included in the structure of the personality as its specific property. And every psychological state, not only psychological, but physiological and behavioral components are always present. Now we have 103 respondents from different countries, Russia, England, USA, Canada, Italy, Germany, Spain, Lithuania, Belgium, Australia, Greece, France, Switzerland, Moldova, Ukraine, Belarus, Singapore, Egypt, Libya, who took part in our survey. We divided them into 4 groups: patients with aniridia, 36 people, the first group; parents of children with aniridia, 50 persons, the second group; parents of children with Vagus syndrome, 15 persons, the third group; and patients with Vagus syndrome. We have only 2 persons. This is the fourth group. Average age is 36.3 years, 20 of them male and 83 female. We really can't take into account the fourth group because we had only 2 respondents in this group. So in the next slides, I will skip this group of respondents. In this slide, in red, we mark those psychological states that are most common in all 3 groups of participants, appearing between 90 and 100% of respondents. A green color showing psychological states that appears between 80 and 89% of respondents, blue between 70 and 79% of respondents, dark red 60-69% of respondents. Then we have purple 50-59, yellow 40-49, and black 30-39. The results of our research show that 83% of the respondents of the first group, 78% of the respondents of the second group, and 87% of the respondents of the third group experience anxiety. We believe that this is the reason for the appearance of various fears in this category of people. In one of the questions of the questionnaire, we asked to list the types of fears that they experience in life. The answers in the first group were fear to lose mobility and social acceptance, fears to be blind, fear to lose my sight, fear about the life of my child when I will be blind, fear to lose a job, fear having kids, fear losing my independence, fear becoming more dependent on my family with progressive silos, fear about my son and grandson who both have aniridia, fear to be dependent on someone, fear ending up alone, fear to lose my rest sight. One patient just wrote, I think we all can write a book about our fears. Then fear about loneliness, fear of loneliness and the end of life and blindness. In the second group, the answers are the fear of my son having no job, wife, and social inclusion, fear that my child will go blind, fear of any future surgeries, fear of future health problems, fear of rejection of my child by society, fear for the future self-determination and confidence of my child, fear that she'll be upset with what she was born, my daughter becoming a blind person, fear that my son will not have a happy life because of his disease. And the third group of people, the answers are, it's awful to live in anticipation of cancer, fear of death of my child, fear if I die, who will take care of my child, fear of mental disability of my child, fear of cancer after diagnosis. Another interesting psychological state is insomnia. Insomnia is noticed by 50% of the participants from the first group, 60% from the second, and 47% from the third. In the first group of respondents, the reason of insomnia may be the low level of melatonin, which according to recent studies in the field of aniridia is frequent, can occur in this category of patients. Also, sensitive hearing can be the reason for insomnia for patients with aniridia. As a psychological reason for insomnia, patients note consistent state of anxiety and chronic stress. The insomnia of the second and third group of respondents has almost psychological reasons: fears, consistent anxiety, having thoughts all the time. We can see that in all three groups, frustration is taking the lead. This psychological state was noted by 95% of the respondents of the first group, 92% of the second, and 93% of the third. The reasons for frustration in the first group are when people don't understand or believe I have a visual problem, when I can't see or do important things for family members or for friends, by my inability to do things quick enough, well enough, not achieving enough in a day, not being able to change the attitude of people, with doctors' incompetence, lack of communication, when I can't help myself and need to ask for help, gradual loss of vision and the inability to stop it, when I can't do what others are able to do, the realization that I have to invest 10 times more effort in the same volume of work that my colleagues do. In the second group, the reasons are bullying my child at school due to his condition. My teenage child has no friends. When I hear different recommendations from different doctors and understand that they are poorly informed about the disease, the realization that no one can help my child, when I see that my child's vision has worsened. In the third group, the answers are when you really try to develop your child, but the results are so minimal, when I feel that the situation will never change and it's forever, in people, even in relatives and friends, when people hurt our family. 58% of the respondents of the first group, 74% of the respondents of the second, and 100% of the respondents of the third group experience a state of guilt. The high percentage of guilt in the second and third group of respondents indicates that parents are poorly informed about the causes of the disease. Parents tend to blame themselves for the appearance of the disease, which is absolutely unreasonable from a scientific point of view. The state of self-doubt is experienced by 83% of the respondents from the first group, 90% of the second, and 67% in the third. An interesting fact is that in the third group, 100% of the participants experience a psychological state of irritation, and 80% experience it often. They describe the reasons for this psychological state is due to, by my child's behavior, children with vagus syndrome have difficulties in behavior. My child will never be like others. There is no way to fix the current situation. Let's take a look at this bar chart with the analytic plotted on it. The blue bars in this bar chart show the psychological states of patients with aniridia. The red one shows the psychological states of parents of children with aniridia, and green, parents of children with the vagus syndrome. An interesting fact we learned from our study, only 16% of patients with aniridia are planning to have children, planning to have more children. Let's look at the answers. Why do people with aniridia don't want to have children? The answers are, don't want to pass on the condition. I don't want to take the chance of possibly giving aniridia to any children because the world isn't ready yet. I wouldn't hand in such a rare medical condition as there is a lot of worry involved. Personal choice, only one answer, and too old, two answers. The answer is yes. Yes, but maybe if I have an understandable partner, otherwise I can also adopt. Yes, but not biological at least. Strong answers, we have only 3 answers. Strong yes, sorry. In conclusion, I would like to say that aniridia and Vagus syndrome, like other rare genetic diseases, have an essential impact on the quality of life of patients with aniridia and Vagus syndrome and their family members. This means that not only physical, but the mental health of these groups of people suffer. During our research, we managed to find specific features of psychological states of patients with aniridia, and we also found a specific palette of psychological states appear with family members of patients with aniridia and Vagus syndrome. This report highlights the disparity between the psychological health needs of aniridia patients and members of their families, and the provision of services to meet those needs. We believe psychological health services for patients with aniridia should be an integral part of aniridia care in places like Aniridia Center, and that this could significantly help to bridge the apparent breach between the level of care that is clearly needed and that is provided. Ideally, aniridia centers should have psychologists working with aniridia and Vagus syndrome patients. Low vision services and clinics should also include assessments of mental health needs of patients with aniridia and Vagus syndrome and gives them access to mental health services. Doctors working with these groups of patients should be informed about psychological difficulties experienced by these groups of patients and their family members. And basically, we would like to thank all patients and parents of children with aniridia and Vagus syndrome who took part in the study for their willingness to share their views and experiences, and without whom this report would not have been possible. The extracts for this presentation and our study. And at the end of this presentation, I would like to say one important phrase. You can be absolutely healthy and unhappy, and you can have a rare disease and be happy. It's only your choice. Thank you very much. I am pleased to be able to share with you this presentation today. Have a wonderful day. Goodbye.